Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Harvey Castro. He's a physician and healthcare consultant. He's the author of the book, Revolutionize Your Health and Fitness with ChatGPT's Modern Weight Loss Hacks. Today, we're going to talk about his most recent Kevin MD article, Tackling the Healthcare Crisis with Artificial Intelligence, Combating Physician and Nursing Shortages in the United States. Harvey, welcome back to the show.
Hey, thanks for having me. I appreciate it.
So we had you on recently talking about ChatGPT and AI, and you're all over LinkedIn as the physician AI expert. Tell me, how did you get so interested in this facet of healthcare tech?
Honestly, it really boils down to the iPhone moment. I was working in the emergency room and I saw how useful the iPhone was. This was when the iPhone 1 came out, and I came up with my first app called IV Meds. And I just was fascinated. So fast forward, ChatGPT came out in December and I was playing with it and I had that aha moment where I was like, wow, I really need to do something in healthcare. And just honestly, I looked at it as a public service announcement. Let me help doctors learn how to use this technology, the good, the bad, the ugly, but obviously the patients come first. And I wanted to do the same for patients. And what started as a PSA announcement became more. And so now I'm really into this.
So yeah, we've only been 4 or 5 months into the ChatGPT revolution, and now we have Google Bard, we have a ChatGPT 4. It's moving so fast. Has it been what you expected?
Honestly, no. Like I said, it was funny because I really thought, oh, I'll just do this and kind of put a book out and help. But I honestly never, I mean, I knew it was kind of like the iPhone, but I didn't think it was going to explode as fast as it did.
Perfect. And there are so many tangents we could talk about that intersection between AI and health, but we're going to focus on one particular tangent from your Kevin MD article about physician and nursing shortages. Now, before we get into how AI can help, give us some context. Tell us about why is this a crisis?
Yeah, unfortunately, as you and I know, a lot of great colleagues are retiring early. A lot of doctors are burnt out. And, it's a combination of things. As our population's aging, there's more patients to be seen. Obviously, post-COVID, there's a lot of strain on our healthcare system. And ironically, even though we're not having the COVID breakout right now, a lot of patients are asking for a different type of healthcare. And as a result, I know personally, a lot of nurses also are quitting.
Yeah.
And so it's just to kind of give you a quick stat, according to the Association of American Medical Colleges, roughly by the year 2033, between 54,000 and 140,000 physicians will be the shortage.
Wow.
And then as far as nursing, according to the American Nursing Association, they project over 1 million nurses that we still need as of the year 2022. So we're really behind the 8 ball here. And so I started looking at this as a problem. And then I started freaking out for my personal health. And I thought, if we're at a shortage today and we're projected to get worse, and we weren't really accounting for COVID and all these other things that are going on, what will our healthcare be in 10 years, 15 years? Is it going to be worse from as it is today? And so I thought, well, we need to come up with some solutions. And I know our government is having more doctors. In the year 2020, they're allowing more rural physicians and there's more grants to pay for residencies, and they're trying to alleviate that as an issue. But I still worry that this is not going to be enough for what's going on.
Yeah. So before getting to solutions, just give us some stories. You're emergency physician, yes?
Yes, sir.
So, what are some stories that you're hearing from your colleagues and from the other doctors and nurses that you talk to about what the situation is like specifically in emergency medicine?
Yeah, it's sad. I'm gonna go back to during the peak of the pandemic. My colleagues were saying they couldn't keep up. They were having, unfortunately, the nurses do as much as they could and order and get as much was done, and making clinical decisions that technically the nurse shouldn't be doing. But there was just such a mass patients coming in that they literally had people dying in the waiting room.
No.
And so it was just an overabundance. Today I'm hearing similar in the sense that they're just seeing so many patients and there's not enough doctors, and they're having to rely on more PAs. And a lot of doctors, especially in the emergency room, I'm hearing a lot of burnout, to the point where about 2 years ago, I got my MBA, and I want to say 70% of my class was emergency room physicians.
Wow. And I'm sure you heard the story of the recent match. There's like 500 plus unfilled spots in emergency medicine.
Yeah, which is a shocker because when I went through, I felt so lucky to be able to get an ER spot, and I know it was really tough to get in. And when I saw that, it made me sad for our profession, because I thought, If our future of America doctors do not want to be in the emergency room, what's going to happen in the ER? You know, it's scary.
All right. So you're an expert in that intersection between artificial intelligence and healthcare. What are some ways that AI can help alleviate these shortages?
Well, for one, it's been accepted in radiology. Obviously, the latest technology that I heard about that I thought was exciting is you see a patient in the ER. Unfortunately, they're having stroke-like symptoms. You get a CT angio, and an AI is able to look at the CAT scan,
Hmm.
analyze it, and then before the radiologist even sees it, sends you a text to say, hey, this person may have a stroke or has blockage, whatnot. And I thought, man, this is amazing. Instead of having the radiologist wait and has this big stack of CTs, now you're getting a quick text saying, hey, this was read by the AI. You still need a human to confirm it, but that's amazing.
Yeah.
Unfortunately, our culture obviously doesn't accept change. Change has been gradual in the field of radiology and pathology. In these fields, we accept AI pretty readily. We think it's okay. Where right now, ChatGPT came on so strong, so many changes have been done, so there's a lot of pause. And so I totally understand. My understanding and goal with ChatGPT is honestly recognize that there are hallucinations, recognize that there are issues with ChatGPT that cannot be used today.
So
But
when you
I do,
say hallucinations, that's a specific AI related term for those who aren't familiar with that. What does that mean?
yes. So to explain hallucination, unfortunately, think of it as a statement that the computer makes, and that statement basically could be half true and half false. And as the unknown reader, you may look at it and say, oh, that's truth, and I'm going to use this technology, when in reality, you shouldn't. And so my analogy is if you're an ER doctor, you can see other ER literature and say, yep, this is correct. But if I look at literature from another specialty, I'm just gonna say pediatric cardiology, and I'm going through and I'm like, yeah, this looks good. But then I show it to a pediatric cardiologist, they'll say, oh, Harvey, no, 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 this is
Mhm.
so wrong. No, this is not even close to correct. And as a doctor, I can bless only things that is in my field, which is ER.
Excellent. So go on. So even though the AI technology is not perfect, you still feel it could help.
Yeah. So some of the things I think today that it'll help is in the medical school arena. Obviously, doctors, I feel like in medical training are good enough to understand what's right and what's wrong. They can use it for clinical vignettes. They can use ChatGPT to create flashcards, to quiz them, to test them. As that technology gets better, I'm not advocating straight ChatGPT. I believe in the future we'll have a healthcare related, let's call it BioGPT or some healthcare database that'll be very specific to healthcare. And when we have that tool, then I think we'll be able to do more advanced applications. But as of today, I think it can help. Simple things today, before we had to schedule our patients and all that's now being automated with chatbots. And
Hmm.
now with ChatGPT is being taken to another level. So I think that's going to help. Ultimately, my goal is if we can become more efficient doctors, then we have more time with our patients.
So take us through a walk in the emergency department, and if you were in charge, how specifically would AI and chatbots, how would that help the daily workflow in the emergency department?
Yeah, I'm gonna blow you away with this one. I would have a camera that takes your blood pressure as soon as you walk in,
Yep.
and it takes your blood pressure, your temperature. You would have your vitals. It would go and be fed into an algorithm. When you walk in, your voice would also be recognized so that it knows if you're depressed, if you're having early Alzheimer's, it would already know. All of that would go into a system that would go into a ChatGPT equivalent and would triage the patient. That patient would immediately go into the room and be categorized, and then immediately we would know what labs would need to be done. There would be no charting. You would go in and have a one-on-one conversation, and there'd be two AIs going, one capturing our conversation and helping me document and help me bill it, the other making sure that everything's accurate, but also putting it in categories so that when we finish our conversation, I can get a risk stratification on, I may have not asked X and Y, and these questions are important. Another thing that in medicine I think is important, especially in the ER, is a differential diagnosis.
Mhm.
If I don't consider certain things, it'd be nice that ChatGPT or equivalent would say, hey, there's a 1% chance of this disease. You haven't asked these questions. Make sure you ask. And then I would ask. These are all things that I think will be possible. How I see AI, I know that's an extreme example, but I do see that happening. One of the things I always usually like to throw in is in the future, we'll be able to print our own medications. So I do see that as another platform that I write a prescription. The patient, this is actually already out there, can print their own medications. But then what I'm getting at is there's a new technology that whenever you use the restroom, there's a application that can look and see what the metabolites are.
Hmm.
And therefore the doctor can readjust that medicine in real time. So instead of going back to the pharmacy, they can do that for their patient.
Now, you're framing this technology as a way to help with clinician and nursing shortages. Now, is there a possibility of this technology working too well and eventually taking the jobs of some clinicians and nurses?
That's an excellent point, and I know that's a big fear. I personally don't see that. I just feel like there's so much hands-on, and there's that physician gestalt and that physician touch on patients and say, "Hey, everything's going to be okay." That will never be replicated by a computer or a robot. I think it's just an augmentation. It'll be an assistant, just like I have my smartphone. I think it'll just be another tool that I can have. Other than my stethoscope, I'll have a GPT equivalent to just help me with my patient care.
So, what about trust in AI? Because we always hear about these edge cases about how AI completely sometimes gets it wrong in some outlier cases, and inevitably these type of mistakes get a lot of publicity and decreases the trust in AI. What will it take for the medical establishment to trust these AI tools?
I think ultimately it's going to have to be a database that is used by, like everybody uses, up to date. If there was an up to date, trusted source that became a GPT equivalent, I think at that point, if you use PubMed and all the resources and just you knew that this was validated by all these sources, I think at that point it would give us that trust. The opposite effect will happen is I'm worried that some physicians may become too reliant on it
Hmm.
and they're going to forget their tools. Simple physical exam, touching the patient, some of the basics, they're going to let it go and start relying more on AI.
We kind of see that already with the advent of technology and scans
Mhm.
and the amount of technology we already have in our disposal. Like some are saying that the physical exam is almost becoming antiquated.
Yes, yes, I've heard that many, many times, but I'm able to pick up things pretty quickly or with a good physical exam. I think it's becoming a lost art, but I love talking to doctors in third world countries that don't have access to this technology and what an amazing exam they're able to do.
So, like we talked about earlier, the trajectory of AI is just going so fast. Like ChatGPT was literally only announced at the end of November or something like that.
Yes, sir.
What needs to be done to keep it on track, to prevent it from going off the rails? What kind of red flags do you anticipate going forward and we need to avoid in order for AI to achieve its true potential in healthcare?
That's a tough one. I think the main thing is always verifying, not taking everything that it says that it's valid, always verifying everything. Even if ChatGPT gives you references, because you can ask it for references now,
Hmm.
I would verify those. My biggest thing that I'm trying to do with patients in healthcare is teach them how to use this tool correct. Ironically, some doctors are using it incorrect, and the way they should be using it, they're not using it. And so my
So, what's
goal is
some examples of that?
yeah. So for example, they're not sure about the hallucination effect. And they're using it, for example, I'm a ER doctor, but I may be using it in a field, let's just say pediatric cardiology, and asking it specific questions and saying, okay, this must be true. I don't know it, but it sounds right. And that's not the way to use it. It's to use it to reinforce maybe some of the areas that you're already good at. So as an ER doctor, asking it for differential diagnosis, but then maybe asking it about some of the rare diseases that I'm like, okay, I did think of X, Y, and Z but I'm augmenting instead of going into something totally blind. I'm using it in that way. So that would be an example.
We're talking to Harvey Castro. He's a physician and healthcare consultant. He's the author of the book, Revolutionize Your Health and Fitness with ChatGPT's Modern Weight Loss Hacks. Harvey, tell us some of your take home messages that you want to leave with the Kevin MD audience.
Honestly, I want to thank everyone for your time and really just educate yourself on AI. It's a new tool. Medical schools are not getting educated in AI, not many. And I think as a physician, we're lifelong learners. So make sure you're making time to learn about AI.
Harvey, thanks again for coming back on the show, sharing your time and insight.
Thank you.